Hello, I'm Armin Budish. Welcome to Golden Opportunities.
Today, there's a painful mystery afoot. We'll crack the case of what sets feet aflame. Then, who wouldn't want a financial gain without risk? We'll check out an investment that might fit the bill. Want to plant a smile on your face? We'll get to the root of your teeth troubles. Plus, we'll travel to the center of an up-to-date breast cancer and screening treatment. And learn how the sequester cuts are affecting you.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Walking on pins and needles. For most of us, that's a toss-away phrase. But if you get peripheral neuropathy, you don't take these words lightly, because that's exactly how you feel. It's painful. Fortunately, Dr. Noel Aboud is here to offer relief, and his solution is shocking in a good way. Dr. Aboud's with the Solon Spine and Wellness Center. Thanks for joining us, Doctor.
Thanks.
So what is peripheral neuropathy?
What it is a condition where either in the hands, but more commonly in the feet, you get a burning, a numbness, a tingling, and oftentimes on the bottom of the feet, you don't feel even the floor underneath your feet.
If you don't treat it, can it get worse?
I mean, worst case scenario can start leading into amputation of toes and into the feet.
Wow. So, but we've all had our feet sore at some time or cramped up. How do we know if it's the shoes, or how do we know if it's something more serious?
I think you'll know if it's neuropathy. Typical cases of neuropathy in the lower extremity, the lower part, is you'll see your legs might become purple or almost black in the legs, and then the toenails will become thickened, lack of hair. You'll see different changes in temperature. You'll feel your feet may feel hot or they may feel cold. You just won't be able to be sure, like that electrical shocking feeling into the feet as well.
All right, so there's a new treatment available for this ailment. Tell us about it.
Well, what happens in neuropathy is typically a blood circulation problem, right? So there's not enough blood, new blood coming in and old blood leaving. And so this waste product builds up in the feet, and it acts like a battery acid on the nerves, and it eats away at the nerve lining. It's called the myelin sheath, and so that's when you get the burning pain. So this technique came about for people that were suffering with diabetes. We put sticky pad electrodes right on your legs and on your feet, and you'll see the feet contract and relax, and it's been proven to increase blood flow by 500%.
Wow, so it's like an electric shock?
It is to some degree,
like
right?
That?
But no, I think we're talking about two different things here.
Okay, right.
But it will contract the muscles, and it is to some degree relaxing. But within 16 days, we're noticing something called granulation, which is on a microscopic level. We're seeing the regrowth of new nerve tissue, muscle, and bone.
Wow. So
been eaten away.
So how long does this process take?
Typically, what I like to do is evaluate a patient, and if I feel they're a good candidate for what we're doing, we'll try maybe 10 sessions, maybe 20, but typically
how long is a session?
It's an hour session, so you're on it. We also use a product called low-level laser on the feet. It's all natural. We're not doing this we're not using any kind of medications at all on this condition.
It's not surgical?
Not at all.
And does it work?
We're finding 7 out of every 10 in our office that we're working on are getting better and getting relief. And these are patients that have had problems for many years.
And you put some results up on the screen. So is this what it does? Mobility is improved?
Yeah, one of the biggest things we see is people aren't walking stable. They feel unstable walking, so they have canes or walkers, and this will bring stability back in and mobility and color into the feet. We have photographs, and maybe next time if I'm on, I'll show photographs of before and after these treatments. You see the skin color change. Yeah.
So how long does this treatment last? Is it permanent, or do you have to
difficult
do it every
to say
few
it's
years,
permanent, depending on the condition. But for most of the patients that we do a tune-up 2 or 3 times a year. Just have them come in for a session, and we seem to do well with it. Great. Some patients, we even have them take the machine home if it's a severe condition.
Great. Thank you very much, Doctor. Appreciate the information.
Mm-hmm.
If your life has focused on the fire in your feet, it's time to put your foot down and get help. Give Dr. Aboud a call. His number's coming up next.
For more information, call the Solon Spine and Wellness Center at 440-248-5070 or log on to www.solonbackpain.com. Next, understanding annuity arbitrage.